but she's afraid to take it. And I asked her why, and she told me because they are so new, Doc, we do not know the long-term effects. Of course, as always, I almost fell off my chair, but I regained my composure and decided to tackle this topic on this podcast episode today. Welcome to your daily health briefing. I'm Dr. Albert Tackett. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Katrina comes to see me as a new patient. Delightful lady. Tells me that she has gained over 40 pounds over the past 2 years because she started a job as a remote worker. And she's heard about Ozempic and Mounjaro on the internet and on radio and television, but she's afraid to take it. And I asked her why, and she told me because they are so new, Doc, we do not know the long-term effects. And of course, as always, I almost fell off my chair, but I regained my composure and decided to tackle this topic on this podcast episode today. So let's delve into the science, if you'll permit me. Let's go back to the origins of GLP-1 medications. What are they actually? Now, the term GLP-1 just stands for glucagon-like peptide agonists. They're part of medications that are incretin mimetics. Incretins are some hormones in the body. Okay? Breaking news. The science behind incretins physiology or chemistry has been going on for over 100 years. But the clinical studies on incretins picked up steam in the late 90s. Now, coming back to the medications themselves, and let's answer Katrina's question. Are GLP-1 medications so new that we do not know if 10 years from today they will make you grow a third ear or make you have an eye on the bridge of your nose? Now, I know it sounds funny, but I have patients who've told me the craziest things about GLP-1 medications. We will tackle that in another episode where we discuss the myth associated with GLP-1 medicines. But let's focus on Katrina here. GLP-1 medicines have been around for over 20 years. The first one to come on the market was exenatide in 2005, FDA approved in 2005. It was also known as Byetta. Later, in 2010, we had liraglutide, also known as Saxenda. In 2017, we had semaglutide, also known as Ozempic. And in 2022, tirzepatide, which you also know as Mounjaro. So this is 20 years of information and data we have on these medications. These medications are widely prescribed. So millions of people take them, and so we have millions of data points on these medications. So are the medicines new? No. Are they safe? Of course they are. We have safety data spanning 20 years on the medications. And if you include the gut hormone science, the data on this medication spans 100 years. Now, this brings me to the most important part of the conversation, the patient-physician allyship to help the patient navigate the complex healthcare system. Because remember, patients are drowning in a sea of information, but very little knowledge. So a doctor's role as someone who understands physiology, understands healthcare mechanics, is to help the patient navigate all of this. And this is where we sit down with patients and we explain to them the data, the science. The medicines are safe. They've been around forever. And if you are someone who needs the medicine, we prescribe them. Just so you know, there are only 3 people who cannot take GLP-1 medications. 1, if you've had a history of medullary thyroid cancer. 2, if you've had multiple endocrine neoplasia 2A or 2B, you or a family member. Or 3, if you've had acute pancreatitis. Outside of that, if you meet prescribing qualifications, you can get the medications. But that's the job of the physician. That's not the job of the patient. We have to quiet the noise in the room and let the patient know that the science is incontrovertible. The medicines are not harmful. They are beneficial. And in other episodes, we will look at the multiple benefits of these medicines beyond obesity treatment and diabetes treatment. But they've been around for a long time and they are safe. The data does not lie. So this is not experimental medicine. We have millions of patients taking them. We have 100 years of data on the medications, and we have a lot of clinical experience actually prescribing them to patients every day. So as we wrap up this episode, I want to leave you with 2 important nuggets. Number 1, do not listen to internet fear-mongering, and especially coming from wellness gurus and unscrupulous doctors who are fear-mongering just for clickbaits and make you click on their content. Secondly, prioritize your health. It is yours. Make sure you rely on evidence-based information so that you can transform your health and recapture your glow. Okay? I'll see you next episode, because the fight never stops. We will keep fighting until you attain your optimal level of health care. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Taken, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.